Our patients come in really with a fair amount of distress about all the different medical things that are going on at that point in time. And it's really important to make good decisions earlier in your course so that you're making the right decisions that meet your goals. Sometimes a goal is to live as long as possible. Sometimes a goal is to accomplish those things that are most important to you before an end that we can't prevent. By thinking about how the end might go, that helps people to understand what they would like to have happen now. And there's nothing better than going through that whole process and getting clarity and then finding out that you don't need it.
When you're undergoing treatment, as I did for quite a period of time, a lot of things bombard you, and a lot of people bombard you. The planning team was an excellent diversion from a lot of the things that are just in your face. You sit down, you're relaxed, you speak in a casual atmosphere, and you get something very important finished.
Well, advanced care planning is important to me because this would give my family the knowledge of my wishes, and it helps for people like me that has this 4th-stage cancer to make plans for their future.
Things get hectic with treatment and emotions get higher as things go along, and the sooner you take care of this, it takes a burden off, to me, off them and you, of something that you don't have to worry about discussing later. And it helps you better take care of them because you know that part's done.
It's hard, it has been hard, but you know, when you know what's going on, it makes it a lot easier for you to deal with and process everything. So I appreciate the fact that advanced care have helped to equip us, you know, with the things that we needed to get through this process with my mother-in-law.
There's a great deal of comfort in knowing what you'd like to see happen. And I'll tell you, as a physician, it's very helpful for me to know that I'm accomplishing the goals you've set rather than the ones that I've set.
To be on the fence just prolongs the fright, I think, that you don't know what will happen in certain situations. So I would suggest get off the fence and do this as quickly as possible.
The changes and the difference that they have made, Heather and the other people, has been, I never would have did it. You know, I never thought about it. But with her planning, the paper that you fill out, it helped my husband, it eased my mind, it eased my family mind. And I would just recommend this for anybody.
It's hard to make good decisions when you're very sick and when you're in pain. The best decisions are made when you're comfortable, when you're thoughtful, and when there's not urgent decision kind of breathing down your neck. And that's why everyone should do this.